And what's the #1 sign that your child is, in fact, ready to potty train?
Well, there are 2 signs. One is you have to be clued into the urge, not afterwards. And then you also have to want to be clean, because there is no other motivator that's going to make a kid stop playing and go to the bathroom unless they want to be clean. So it's a developmental milestone, just like learning to walk and talk. And for girls, it's usually around 2, 2.5. For boys, it's usually around 3, 3.5. And that's because they don't care. And it's true. And I will tell you from personal experience, my daughter, she trained at 2, 2.5. Our son, let's put it this way, my husband and I had a bet whether he was going to be toilet trained or reading. And he was 3.5 and very smart. And I will tell you, the smartest kids are often the last to toilet train. Mom is not a good reminder because she sounds like a nag, and so they get the pushback from the kid. So using a potty watch like this or using a kitchen timer is a nice reminder, and the kid can't argue. You know, you can't argue with the timer going off. And then the kids eventually get some body awareness, and they don't need reminding to go to the bathroom. So it's a good choice for maybe an older child who needs some reminding occasionally.
Okay, up next, let's get an update from Narisha and Ethan on the little mark. Great job, Ethan. I mean, so how are things going with Ethan?
Well, at first he thought it was a toy, and he dragged it everywhere. Then he tried sitting in it, stepping in it. So that was interesting. But then he actually got to use it, and he seemed like he started liking using it. Before, he dragged it in front of the TV, wanted to show whoever's on TV that he can do it. But now he actually does it on his own. But it's funny enough that now that he's actually gotten to use it, and he's been doing very good at it, I've been trying to now switch him from that to do it into the actual toilet.
Gotcha, to switching over to the toilet.
Yes, but he hasn't done it at home. I've tried about like a week and a half, just keep at it. And actually, like maybe about an hour ago, he goes, "Mommy, I need to go." And we actually went here for the first time. And actually
Touchdown!
Yes.
Well, we are proud to be a part of your family in that special way. So, Dr. Ari, what are your thoughts on this?
You know, parents of boys ask me all the time, do I teach them to squat or to shoot? And what I advise is let them pee like a puppy until they're big dogs, because it takes some eye-hand coordination, if you know what I mean, to get them to point and shoot. So this might be a good product for a child who needs some shooting practice.
Gotcha.
And for a mom who maybe doesn't want to puddle on her bathroom floor.
Right.
Yeah.
So maybe another good transitional thing. Jumping against that Cynthia and lovely Lily. Hello, Lily. You look gorgeous today. I love your dress. How's it going?
Oh, she's a little tired.
She's got pretzel thing going on?
She does. She's got a lot going on.
Nice. So how are things going? Let's get an update on Lil.
You know, the toilet time targets worked for us in the very beginning. The first day, they were novel and they were exciting, and she loved looking at all the little pieces and playing with them. And by the second day, she was over it, really. Yeah. And then through the week, it almost became difficult to get her to use them, because sometimes she understood she had to go potty, and she would run to go potty, and then, oh, wait, we have to go get the toilet time targets for you to play with. And then it started to not make sense. And then she had another surge of interest and thought they were really, you know, exciting
cool again.
And they were cool again. And she looked at all the pieces and she loved it. And it would last one day, and then that was it. So it was a springboard. The best way I can look at it, it really was a springboard for us, because it started her being interested in what the potty was about more than she was before.
And getting that awareness together.
So it started her going, but it wasn't the answer to making it work for the long run, but it definitely got her interested. So, you know, I would say it was a springboard.
I don't know if everybody gets this, but these are like little paper cutouts. It's just like little colored toilet paper animals, basically. And they looked kind of fun to me, I have to say. So what do you think about this, Dr. Ari?
You know, I think the bathroom can be an entertaining place, whether you need to read a magazine like she did. And, you know, adults, we sometimes check email now. Admit it, who checks email in the bathroom? But, you know, so for a kid, you might need some entertainment to keep them engaged in the bathroom. But also, there are some kids who actually have some real toilet fears, because little kids can't separate fantasy versus reality. And I've actually had patients who have these fears of the toilet monster who's going to suck them down the pipes. Wow. And so for some, you know, for a fearful child, something like this might demystify the toilet experience and make them a little less afraid. So it might be appropriate for a fearful child.
And distract them away from the toilet monster.
Make it fun so they're not so scared.
Exactly. Top 2 two tips to wrap it all up?
If you're going to use bribery, which I don't recommend, if you're going to give a toy or something, I wouldn't recommend giving it to them. They get it on loan for being successful, but if you give it to them, why would they ever want to go back on the potty again?
That's right. Yeah.
And then remember that this is a developmental milestone, so it's not a reflection of your parenting skills. Some women, pregnancy is the best sex they will ever have in their entire life.
Some will actually experience their first orgasm.
Yes,
during
so
pregnancy.
it really depends. And so what I always tell people is enjoy it, and whether it's intercourse or some other form of intimacy, because there are other ways to be intimate with your partner, enjoy it, because you ain't going to get it after you have a baby for a long time.
Oh, I know.
And, you know, if you have good sex, you have good mental health, which is always good for your pregnancy.
I mean, what exactly are you recommending to parents?
Right. Well, if you actually look at the policy statement from 1999, we're actually reaffirming the comment that we made. We discourage media use in this age group. We didn't say no TV, although that's what the headlines read. And we know that you can't keep your child away from a screen 100% of the time. But what we're trying to inform parents about is that in this age group, televised programs are not educational because the program gets lost in translation. They simply can't understand the content and context. So if you're trying to feel good about putting your child in front of a program so that they're learning something so you can cook dinner or take a shower, you're really not doing that for your child. It's entertaining, but it's not educational. And so we really want parents to hear it and make a thoughtful decision on media use for their entire family.
We have the other side of this perspective. Dr. Ari Brown is a pediatrician and spokesperson for the American Academy of Pediatrics. She's the author of the Expecting 411 series. Thanks for writing them. This is a big debate, obviously. What are your thoughts, and in particular, what is the thought of the American Association of Pediatrics?
Well, my concern is this. A delayed vaccination schedule is leaving our youngest, most vulnerable babies at risk for very serious diseases. Multiple studies have shown that there's not a link between vaccines and autism. The question has been asked about vaccines, and science has come to the table and answered it. And we have a decade of research that has looked at this. And as an example, there was a 2008 measles outbreak in San Diego where an unvaccinated child developed measles, was in the doctor's waiting room, where other unvaccinated children then got measles. In fact, one of those children was too young to be vaccinated and contracted measles and ended up in the hospital. And I think those were actually Dr. Bob's patients. And so these diseases are very real, and these are not diseases that we want our kids to have.
Dr. Brown, if I can just get a word from you, how do you reassure someone who's just petrified that vaccines can cause autism?
Well, what I tell families is this, is that, you know, you have a car seat for your child. If you chose not to put your child in the car seat for the first 6 months or the first 2 years of their life, you're just hoping that you're not going to get in a car accident. And that's something you can't control. And the same goes with infectious diseases. This is not something you can anticipate and see coming. And I will tell you that 60,000 pediatricians would give you the same answer, and we wouldn't do anything differently for your own kids that we wouldn't do for ours.